Of your team, Director Taylor, Secretary Costantino, Director Stenning. You have really distinguished yourselves as a team that really understands the urgency of healthcare reform and continues to position Rhode Island in a very strong place in terms of not only the work you're doing, but really creating a national model. I want to acknowledge the leadership of both of our senators, but particularly Senator Whitehouse, who has made this issue a very important one in his work in the Senate, and part of all the work he just described are things that Sheldon has been involved in from the beginning. So I want to salute him and applaud him. Great. I also want to say that I'm the most junior, so my senior colleague, Congressman Logan, I know regrets he can't be here, but is in Washington working on a bill of his own, and I know he would want me to express congratulations to everyone who's been part of this. This is a huge opportunity for our state, really, to develop the foundation for an integrated model for services to the disability community, for cognitive disabilities, and it is a really important and good example of how we improve the quality of healthcare at the same time we're reducing healthcare costs. And as Sheldon mentioned, there are some folks who think the way that we reduce healthcare costs is to make healthcare less available to people or increase the cost to the individuals. Instead, if we make the right investments in building models that can improve care and in building efficiencies, we can improve the quality of the health outcomes at the same time we reduce healthcare costs. That's the goal. That's what this model will allow. I want to congratulate Professor Goldstein for her visionary application that was an incredibly competitive grant. It speaks to the quality of the team, but also the quality of the ideas behind it. So congratulations to you, and we look forward to this work as Rhode Island continues to distinguish itself as a national leader in healthcare reform. Thank you. Now I'm honored to introduce the great mayor of the city of Scranton, Mayor Bob.
Thank you, Congressman. I will be brief. I'm proud to be here with the governor and members of the staff and our congressional delegation to congratulate, President Dooley, members of URI, and in particular, Professor Goldstein on this wonderful accomplishment. But in particular, on behalf of the city, we are very proud to be here at Access Point RI, as many of you probably know, in typical Rhode Island fashion, formerly Cranston RI. Because I want to thank you for the collaboration with Access Point and many of the individuals that they serve, many of whom are Cranston residents, but also many people throughout the state. It is a wonderful day to lead an innovation in such an important area such as healthcare, and we're honored to have you here in our great city, serving many of our wonderful people, hopefully making changes for the betterment of for people, not only in Cranston, but throughout our great state. So congratulations, and I wish you the best as you undergo this effort. Thank you, Lisa.
Well, grants like this are selected because of innovation. In fact, this is a Healthcare Innovation Award. And obviously, a tremendous amount of credit goes to Professor Goldstein for creative ideas and her entire team. But it takes a village. And the village in our case, and we're blessed, I think, here in the state of Rhode Island, because we have an extraordinary congressional delegation who get it, who care deeply about the state, the citizens of the state, and understand the broader implications. Senator Whitehouse, thank you very much. Senator Reed couldn't be here today. Congressman Cicilline, Congressman Langevin, you've always been there for Rhode Island and for the University of Rhode Island. And in fact, I should mention, I would be remiss if I did not acknowledge Senator Whitehouse in particular, because he brought the director of the CMS Innovation to Rhode Island last December or thereabouts, as I recall.
Come to Rhode Island. He's a Lincoln boy.
Yeah, there you go. We're back home. And while that didn't provide a unique opportunity for this particular proposal, it did provide a unique opportunity for the state of Rhode Island. Senator, we're very grateful for your role in this, as well Congressman Cicilline. I also want to acknowledge, Senator Reed really did want to be here today, and Chris Alpert from his staff is here. Chris, where are you? Thank you for being here today. Nancy Beatty, Nancy, where are you? Thank you from Congressman Langevin's staff. We're very grateful that you're here. And I believe Craig Stenning from as the Director of Behavioral Health Care, Developmental Disability and Hospitals for Rhode Island. Where are you, Craig? Thank you for being here as well. Now, while we're celebrating URI quite a bit today, I want to be very clear, there are some very, very important and significant partners in this grant. And 4 come to mind in particular. Those are the 4 sites, one of them right here, Access Point, Rhode Island, formerly, Mr. Mayor? Cranston Arc. Cornerstone, Generations, and Seven Hills. Without these partners, this project will not happen, and the opportunity to develop and implement a new approach to healthcare would not have an opportunity to take off here in Rhode Island. So I'm very pleased to invite to the microphone Lori Gaynor from Access Point, Rhode Island, to say a few words on behalf of one of our key partners.